exciting. Let's let some people come in. We are now live for session 2. Waiting for people to get in here. Linda, are you excited for this session?
I am.
You're pumped? We're ready to go?
I haven't had that much coffee, but I'm excited.
I didn't have that much coffee either. That's true. I didn't have that much coffee either. I definitely would like to have a cup. That would be great.
For sure.
So that right, we're gonna begin. So welcome everyone to TMF Week 2022, and thank you for joining us today for our second day of TMF Week. For our next session, no budget, no team, no buy-in, how to TMF without everything you need. I love that title. My name is Kimberly Bruce, and I work on the marketing team here at Montreal. And I'm incredibly excited to be your host for today. Before we begin, I just like to double check that everyone can see the presentation and that you can all hear me okay. So if you can, just write in the chat, yes, we hear you, or you can also write down like where you're from in the live chat section, which is found at the side panel that's located on the side. So if you just click on the live chat, just write in some information there. Yep. Perfect. So that's great. So now I'm just going to move on to the housekeeping slides, just so that we can, make sure that we're on the same page. All the TMF week sessions will be recorded and made available at the end of each day. So same goes for the slide decks. Each attendee will receive an attendance certificate for the entire TMF week conference. Because like we said, you have to show off what you learn, and what better way to do that than to share it on your social media platforms. And please feel free to use the Q&A section to submit any questions at any time. This is an interactive session, so we really want to make sure that you are asking as many questions as possible to Belinda, so she can answer any queries that you might have. And like with the live chat, the Q&A section is at the side panel located on the side of your screen. And then we have the Q&A section will take place at the end of the presentation. And also feel free to visit Montreal's booth or the networking lounge after each session. So now that we've got the rules out of the way, I would like to introduce your speaker for today, Belinda. Belinda has over 30 years of CRO, pharma, TMF vendor, and TMF consulting experience in clinical operations, project management, quality management, and records and information management. Belinda has extensive knowledge of the TMF implementation through archive, inspection readiness, and ICH GCP. Belinda is passionate about all things TMF and has a passion for helping others understand that the TMF is the representation of the work we all do every day for the patients. She believes we should let it tell the story by itself. So I want to just say welcome. Get that off. I want to say welcome and allow you to share your screen, Belinda. Perfect. And we're just going to add that to the stream. Okay. Great. So let's get this party started.
Awesome. And first of all, Kimberly, thank you so much, because I was one of those that had technical issues. So that was pretty horrifying in the last 15 minutes.
It's all good. It's all good. Lots of help.
Okay. All right. Awesome. Thank you. So obviously just the usual disclaimer. So the views and opinions expressed in this presentation are my own and not representative of Taysha Gene Therapies. Yes, the provocative title did make me laugh. I think I was talking to Oliver at the time, and we recognized it was pretty provocative. But I think as we jump into this, you'll just understand more around the context of it. So I think I just wanted to start off with, so why? So why this title, and why did I want to bring this to, to these sessions? And I think it's just come from the last few years. So either in conferences I've attended or forums I may belong to, some consulting I've done, the topic of lack of resources or support or finances is a real thing for many of our colleagues in the industry. I myself come from a startup, but it was definitely something that, as I was talking to individuals and we were looking at, the startups versus the bigger companies and looking at niche companies or boutique companies, that over the last few years that there's been, tremendous growth in that landscape, but with current things that are happening in the world, like the pandemic, etc., it has caused some stress on those organizations. So there is limited investment right now, and definitely departments like TMF operations, and by no means only TMF operations, there is limited investment in building out those infrastructures. And again, this is completely justifiable. Again, if you're looking at how these companies are bringing in money through investments, they need to make some hard decisions about where that money is going. And obviously for us, it's going to be, the upside, bringing patients in, making sure that sites are getting paid, etc., making sure that departments are there to look after patient safety, etc. So I think, though, for us as TMF professionals, that brings a lot of challenges, risks, and choices that we have to make as we balance, like knowing what we have to or ideally have in place, what regulations we may have to meet, but then balancing it against truly what can be afforded by your organization. And I think that is really just why I wanted to, to acknowledge that. And by no means do I have, all the answers. Definitely not. And so really would appreciate other people's thoughts and opinions. And yeah, please make this interactive, and let us know what your struggles are and what you're doing to overcome it. So over the next few slides, I'll just talk about some of those impacts and risks, and then ultimately, how we can still strive for inspection readiness in this landscape. So if we look at some of the potential impacts, right? So if we look at budget, you can bucket into various things. So you can look at maybe technology as a bucket, resources, processes, and obviously people as well. So, technology could be that you don't have an in-house TMF, that you can't use tracking. I know yesterday's conversations were really big and heavy on storyboarding, which is, definitely something I'm advocating for and highlighting in our next slide. But that takes manual effort. If you don't have a CTMS system or some other kind of automated tracking, you're going to have to be entering in that data yourself onto an Excel spreadsheet. We also have limited access to dashboards and reports. So that means we're going to have to, again, use a different mechanism to try and have those visuals that some people actually like seeing if you don't just want, raw data on an Excel spreadsheet. Then resources, yes, so we're definitely not going to have people to help us build out our infrastructure or perform our day-to-day activities. And all of those activities that we know that we want to do at a minimum to meet maybe regulatory requirements is going to take extra effort as well. And then buy-in. So in this instance, it's really, as a startup or a niche sort of company, whether it's sponsor or CRO, if you don't have buying power with your vendors, so you're, essentially a low revenue stream for them, you're probably also going to have some, potential struggles there as well. And then processes and SOPs, yes, again, if you don't have the resources, you're just not going to be able to put those in place. And I think the other thing about processes and SOPs is obviously we realize it doesn't just impact us as TMF professionals. Many of our processes involve other functional teams or groups, and they may not have they may not have the people in place to actually execute on those processes or SOPs. So it really you know, the whole thing about the processes and SOPs is not just siloed for the TMF operations group, and you really have to look at your broader organization. You may not even have enough QA, you know, folks to help support putting SOPs and processes in place. And then, of course, lack of inspection readiness. And then I think one of the other things that I've also noted over the last few years is that if you don't have a TMF group, or, you know, maybe it's not even a group, maybe it's just one individual pretty early on, that you don't have that history on why some decisions were made. And you generally find people are obviously focusing on, you know, starting up studies, getting patients in, and the documentation surrounding all of that is probably like an afterthought. So, and maybe a little siloed as well. So you could walk into an organization and you'd have to really dig to understand where all the documentation actually resides, and you know, if there is documentation, because each function would have just been trying to, you know, do their part, and then they may have just put their documents on a drive or a certain part in Box, whereas another functional group may have done something similar, and documents are in another spot as well. So then the impact of no team or being under-resourced. So again, very self-explanatory, but I think one of the biggest things is also the, you know, the lack of sort of diversity of skills, right? So I may be very comfortable on the operations side, and maybe you know, I can support operations and do my TMF function at the same time. But I may not have knowledge on, you know, true records management. So maybe I'm not that familiar with migrating or, you know, or implementing. So you really lose out on the opportunity to have that sort of holistic team that, you know, can address all situations. And then I think just on the human sort of side, you know, it's like that, really that lack of growth and support, and, you know, the constant juggling and prioritizing that you have to do, which can, you know, it can be wearing at times as well. And then, you know, the risk of no buy-in. So again, that could be on the financial side, but it can also be if you're, you know, just a department who is, again, perceived as maybe just shuffling paper, then it's really hard to build those relationships. And especially when other groups are also stretched as well, they may not really understand the importance of it, or they may understand the importance of it, right? But they also, you know, just trying to get accomplished what they have to with their limited resources. So definitely that could be of impact. So I think one of the things that I really just wanted to highlight is, as you start to just assess your situation, look at what you can put in place with, you know, limited resources or budget or buy-in. I did want to highlight that there are, I mean, just absolutely tons of free resources out there. You know, obviously we'll put TMF reference model right at the top. Again, besides the documentation that they may have available, so free templates, you know, joining the forum itself, you can ask questions. And there are, you know, just again, tons of industry sort of thought leadership members that are part of that, and they will answer your questions. So I think that is an incredible resource for many. Definitely subscribe to regulatory sites so you can get updates, so you can actually just understand what the regulations are and start pulling that for yourself. One of the other things that I've utilized a lot is like a site like Montrium and some of the other. Again, they have you know, so many resources, white paper on activities. And I think one of the other things that is really helpful as well is that, you know, as you sign up for these newsletters or join these forums, is that you will get to know what is happening in the industry and what you need to be thinking about. Which is obviously very helpful if you're just sort of a party of one, because you don't have the time to be reading all of the, you know, documentation and, you know, pouring through pages and pages and pages of guidance and really getting sort of stuck in that web of like, what do I need to know? And, trying to join all of those forums and, trying to figure out, where you stand and how it impacts you. I just highly recommend, following those people on LinkedIn so that you can just keep abreast of what's actually happening in the industry. Of course, there are a few paid resources as well, and that you can definitely see if you can at least maybe add that to your budget as well. So again, before we look at what we can do, I'm probably going to make the assumption here that you have a really good idea of what your current situation is. So and that it's documented. And I think that's really key, again, as a TMF professional. So we need to be able to justify decisions that we've taken where we recognize that there's potential gaps like in regulation or industry recommendations, and maybe why we made those decisions. Again, if we take any kind of risk-based approach, again, we want to make sure that we're documenting our thoughts behind it. One of the things that I've looked at is, so we have an outsourced CRO, TMF, but in-house we don't have anything currently. So it's something that I've looked at, so, I'm not going to be able to bring a TMF in-house, so I've got to look at a different option. And obviously the only options that we have are things like a SharePoint site or a Box site, or maybe just go completely old school and look at putting it on a drive. And again, as a TMF professional, that's a very uncomfortable place for us to be, because we know that we're not going to meet some of these regulations, right? Because you can't pull audit trails from that. So what I've done is I've listed out what I know are the regulations and recommendations. So, a system that can do audit trails that I can control access to, that I can maybe sort. So I will list out like a various sort of, things that I would want from a system or need from a system based on, again, regulations or industry, and then look at the options that I have, and then you're going to literally weigh them, right? So you're going to have your pros and cons of each system, and then I'm going to have that available really for my senior leadership to look at, so that they can understand maybe why I've chosen one over the other, and everybody understands what the gaps are, right? Because again, I know, that from a financial perspective, obviously they would want to put something in place, right? Because we all want to meet regulations, but perhaps it's just not possible. So again, I would want to make sure that I'm highlighting it and that I have it documented out and that I have that evidence for future for folks to see. One of the other things that I've seen a lot is that so in the startup environment, as we're just getting things up and running and we're bringing on so many vendors, sometimes we don't look at the contractual verbiage. And again, that's just something that I would highlight very strongly. You want to make sure that everybody understands, from a TMF side, what documents they're responsible or accountable for, where those documents are, where it's been stored, and how they manage inspection readiness activities. So one of the things that I've done is, even though I understand my current situation, I'm still building for the future, right? So I'm still looking at what does my outsource model look like versus my in-house model. And I'm still making sure that I understand what are all the activities for a TMF group, right? So looking at, down the road as we continue to grow, what it should look like, and trying to build towards that. One of the other things that I think is key is make sure that you understand the cost associated with all of these activities. So make sure that you know how much it's going to cost your department or your organization to keep a outsource model versus an in-house model, and you're looking at things like bringing on people to do it, processes that you need, etc. So just make sure that you have a really good understanding of budget impacts. And then I think one of the other things is that even though even though you may at the time feel as if you're not getting that much support, and TMF, continues to be something that they may just leave you to handle off on the side, just continue to publish what you have. So, whether it's an executive summary or just a monthly summary or a newsletter, or at our organization, we use Slack. Even if you just put in something there for teams to see, just continue making people aware of what you're doing, of what's happening in the industry, and trying to forge those relationships, and then just to continue to build the TMF ops group for the future. So then if we look at some of the things that we can achieve, right? So I've put down, and maybe in a way of priority, I guess maybe is how I've listed it, but definitely one of the things that we can put in place is some kind of TMF plan or sponsor oversight plan. There are definitely free templates out there, free examples, and we should absolutely be using them. If you're on the sponsor side and you have an outsourced TMF with your CRO, again, I would highly recommend either having a TMF plan or making sure that it gets covered in a sponsor oversight plan, because there will definitely be content that would not be appropriate for your CRO's TMF, and activities as a sponsor that you want to make for sure that you're documenting. So again, I've just listed a few things to consider, and that these would not, again, if you want the sponsor side, would not be appropriate for your CRO to be handling for you. So again, just making sure that you understand where all TMF content is housed. Again, the activities that you may do, so periodic reviews, etc., as a sponsor in an oversight capacity, and then your expectations around metrics, any kind of risk-based considerations that you've taken, and then what kind of data integrity checks you may need to be doing and how often. Then I touched on this a little bit in the previous slide, but again, if you have an outsourced CRO TMF and you have sponsor content, right, but you don't have a TMF to house it in, and you may need to look at a SharePoint or Box or a local drive, again, I would highly recommend that you do that a similar assessment. So list out what are the risks of actually using something like that, and then make sure that that gets filed along on your site, so that again senior management can actually have insight into why some of those decisions were made. And then on the tracking side, if you don't have a CTMS or similar kind of tracking, again, I would highly recommend using a storyboard. In the startup environment, we definitely do not want to duplicate, well, in any environment, we do not want to duplicate content. So, again, you can just link to where that source of truth is. But I think just consider the storyboard as a multi-use tool. So in our current environment, we have a storyboard, which I have some tabs on that are applicable from a TMF side. And then the clinical ops team and data management team utilize it as well. So we have the EDL on it, we have metrics on it, we have sponsor oversight on it, and then we actually have the details that would usually be in a CTMS system, like the site details, site numbers, the usual cross-checks and sort of codependent checks around performing file reviews, right? So when studies were approved, ROV documentation, consents, that kind of thing. So again, just consider using it across a number of functions. And I think one of the other positives around that is really it just helps me build relationships with our functional groups, right? Because we're sharing a document and we're making it available so we all can see what we're doing as well. And it serves the purpose of helping being inspection ready. And then For metrics, so again, granted, if we have sponsor content that we're keeping on Box or SharePoint or something similar, we're not going to have any sort of metrics that we can pull from that. So we may have to utilize that, expected document list or something like that in an Excel spreadsheet. One of the things that I have been using as well is Power BI. Or you can use Smart Sheets. So again, if your organization does have that, you can actually load your EDLs into it, and you should be able to pull out some visualizations. So again, one of the other things I would recommend is again trying that whole multi-purpose approach. So really having maybe one spreadsheet that has, so maybe it's your EDL, and if you're doing some content review as well, you have some additional columns there, because then in the end you can load one document, but you will have a whole lot of sort of data points that you can pull into visualizations. So I think the takeaway from that is just look at how you can cross-functionally use something, and how you can grow, and how you can use one document, to gather as much information as you can. So I know we touched on the SOPs and work instructions. So again, obviously it's desired and recommended that we have SOPs and work instructions. But again, as we discussed, it's really not practical sometimes in a startup environment. And we have to make sure then that our TMF expectations or contents or activities is captured somewhere else. So it may just be a TMF plan or an oversight plan, or maybe you could include your content in clinical operations SOP or a vendor oversight SOP as well. But just make sure again that you know where your TMF activities is being captured. And then I think certainly for me, I've still built up my TMF ops structure. So I still have a place where functional teams can, go and grab documents related to TMF activities. So whether that's best practices, guidance documents, frequently asked questions. I have, I like to just call it my implementation roadmap for the group, our current state, how we want to grow it as well, that's loaded there. Some training materials. So I think it's still just, important to have that place that defines your group and that, people can go there to still grab what they need. And then I think just from the buy-in perspective, there are, in the instances kind of mentioned above, there are ways that you can just really build that relationship. And that is kind of just what you need to do, right? So you need to just find ways to connect with your functional teams. And maybe that is using cross-functional documentation. And so that they have a vision into what you're doing, and maybe in a way you're helping them, right? So from my side, because I have some clinical background, I'm very comfortable, maintaining storyboards and adding documentation that would obviously be, relevant for the ops team. If that is something that you can do, again, it's sharing those resources and that knowledge, and just finding ways to be connected to that group so that you can continue to highlight just why it is important to have these and how it will help keep the TMF inspection ready and help us all understand what is expected as well. And I think just, the bottom line is just start small and just continue to look for those opportunities to insert, TMF operations where you can. So I think that was it. But just again, just to summarize that, even though we may have limited budget or resources or buy-in, that there is really enough templates, free resources out there for us to actually have a good understanding of what is expected from the regulation perspective, and to try and address that. And that's really just what the intent of this session was, just to make sure that we recognize that it's there, that we're documenting why we may make certain decisions, and that we continue just building out a roadmap for our organization. And then just to say thank you to Montreal. These sessions are really key for very many of us, so we truly appreciate the opportunity to join and to present.
Great. That was wonderful, Belinda. Thank you so much. I'm just going to ask you to, yes, remove that from your screen. Perfect. We got some questions for you. So just want to let you know that this was a very insightful presentation. And I think it gave a lot of food for thought for people who don't have, the means to, get expensive things for clinical trials. So it was very insightful in that sense. So I'm just going to put up the slide for Q&A and get the ball rolling. So the first question from Ashish is, can a sponsor ask a CRO to manage sponsor TMF as well as investigator TMF?
So I think the problem with that, right, is as a sponsor, you may have content that is not appropriate for your CRO to see, or that you would not want them to see. Mm-hmm. So there's a good majority of documents that your CRO can house for you, and even in our situation, our CRO can keep a good amount of our content. The issue with that is, that they do not may not manage it, so include it in the expected document list. And I'm sorry, I saw what is EDL, so the expected document list or placeholders. But you're always going to have content that is just not appropriate for your CRO to keep. So I guess the bottom line is no. You're always going to have a place where you're going to have to put content that is a little bit more restricted.
Okay, excellent. Good answer. And makes perfect sense as well. Another question, in your opinion, why do you think it's always a constant battle with management to get buy-in for better TMF management? Why is that? Why is that so hard? Why?
Yeah, so I feel like if you had asked me a few years ago, I would have had a different answer. But I think just on the consulting side, and recently now where I am, I think that it is truly sometimes financially driven. I think that we all have this perception that we've had. TMF has just been brought to the forefront in the last few years, for sure. And so we all have this perception of, our companies would not want to have regulatory findings. If we know what the issue is, why can't we fix it? But I think that companies are still having to make some really hard decisions. And I think that we're just one of those departments that unfortunately does get impacted by that. So again, I think if you just understand the environment, right, we're always gonna want to make sure that our patients have what they need, right? So again, on the operating side, that is probably going to be more of the focus. So I just feel like for me, it does come down to finances sometimes. I don't know if I've truly come across, that many people that are just so anti it, don't see the need for it. Mm-hmm. You're going to find someone in the organization that will support you, and sometimes that is what you have to look for. Find that person that will fight for you.
Yeah, that will have your back when the situation is there. Absolutely, I 100% agree. And so it makes you think of change. Maybe it's a new system. They don't know what that work that would entail on their end. So maybe that's another reason as well. But that's a very good point.
Yeah, that's very true. Sorry, Kimberly, I was going to say, and I think that's also, that is why I think sometimes maybe the perception of TMF and records management can be, the people might just perceive us as being a little siloed sometimes. And I think that's why sometimes it's good to look for those ways to connect, right? So not always making sure that your TMF part is the thing that you bring into the table, but look for other ways to connect. So for me, like storyboarding, right? So I know that the ops team don't have people that can manage that, so I'll take it on. And that's the way that I can keep bringing to them, oh, if we do this, then I'm checking it against the TMF, or oh, you said we had this approval, but I just checked the TMF and I don't see it. Now I know that that's not feasible for everyone, depending again on your resources, studies you're doing, but I think we just need to make sure that we're not so regimented, that we're just finding a place of common ground and building from there.
That's very good and makes sense. I'm going to go on to the next question. So thank you for that, Belinda. Next question, if you are using SharePoint to create a TMF, is there a way to validate the system to make sure it's in line with industry standards?
Yes, so it's something I've investigated myself. So you can validate SharePoint. I'm going to say it costs somewhere around $5,000. The problem is you're not going to have the level of audit trail that you want. There is some functionality, but it still doesn't meet the requirement. And honestly, I've just spent a lot of time just on Google. Google's your friend. Just looking and digging and trying to figure out what there is out there. Again, the same for Box. I think there is a validation that you can do. But however, again, we're always going to run into the trouble of the audit trail. And so you just need to figure out the best way forward, right? So making sure that you're limiting who has access, looking at what process you have before you add those documents to SharePoint. It takes some thought, but the only way that you can do that is to really just list out those pros and cons, and then what processes you would take to try and address those gaps if you can.
And the other thing is, let's see over here. When it comes to the idea of like building the partner roadmap, is there the best way to define in a document and present as a business case, or is there another way to do this when it comes to building the partner roadmap?
Yeah, so I have actually put mine in Smartsheet. And I've broken it up into the buckets that we've discussed. So I have, people, technology, etc. But I literally have every activity listed from start to finish. And then I've also have it by in-house versus outsourced model. And the reason why I am using Smartsheet is because I can take some of those data points and I can make them into visualizations, right? So I can present on, if I have 5 studies, but I only have, these amount of resources, I can only do this targeted sort of activity, and I can actually just put that in sort of like an executive summary, and like a Word document, and send it to leadership. The other thing about putting it in Smartsheet or Excel or something like that is that you can just keep going back and refining it, and at some point you can obviously close out things, right, if you're achieving them. So it's a good roadmap to actually see, what you've achieved, what you've prioritized, and then you can obviously also add priorities to it, right? So you can make some of them red, like these are critical because if we don't do them, we're not going to meet a regulatory requirement. So again, those are things that you can filter on and add to a Word document and send to senior management.
Thank you very much. And we have another question. Can you elaborate more about the free paid resources where we gather information about the TMF? Because you had mentioned that in the presentation that there are free versions. So
yeah. So for sure. Yeah, so absolutely. I have on my favorites the TMF reference model. So again, I would say really that is probably the best one for most people to join, because not only do you have free templates, you actually have presentations, right, for like the last few years of presentations as well, where people have jumped on and discussed various topics or things that have happened in the industry and how they're doing things or managing activities, but you also have the ability to post questions. And I think that that is really kind of priceless, because if you look at the individuals that are on those, on the forums, the committees, they are like our thought leaders. So there are some awesome people on there, and you want them to be seeing your questions and giving you the best advice possible. And then, like I said, TMF vendors like Montrium, again, if you go onto their site, again, a wealth of information. So I think those are, if I had to say, so I would definitely TMF reference model, look for all the TMF vendors, and then some of the consulting companies like Just in Time or L&K or Daylight. Again, just go onto their websites or go onto LinkedIn and follow those companies and follow those individuals. And honestly, that's how I get all my information. And make friends. That's well.
Making friends is always important.
Friend line.
It's true. You get the connection. They can tell you some things that they're using. Yeah, absolutely. That makes sense too. So one of the other questions that we have here, is it efficient for partial outsourced TMF parts to work on 2 SOPs, one from CRO and sponsor?
So, I mean, I would say that that leaves a little room maybe for error. So I think if you're going to outsource, right, you're probably going to use your CRO's SOP. You're very likely not going to have something that addresses that, unless you're kind of like in this hybrid model where you're trying to move things over. I'm probably just going to say that it's probably not the best. It will probably be frustrating for the CRO. I think if you have that outsource model, you're probably going to have to just use their SOPs, or just understand that if it's a process change, it might have an impact to the budget that you have with them, right? So you're going to have to investigate that one, because there may be bigger impacts there to consider. But yeah, I just don't create extra work for yourself, I guess, is what I want to say.
Yeah, absolutely. That makes sense too. Hold on one second. I'm just going to try and a lot of great questions here. So somebody had written here, for those restricted sponsor documents, how are they managed or provided during an inspection, given the TMF is with the CRO? Would that documentation be provided directly, or are they directed to the SharePoint box?
Yeah, so that is something that I am looking at the moment, and I think so that was definitely one of the other criteria that I looked at, right? So if I list, what are the things that I may use, so whether SharePoint box or a local drive, one of the questions is about inspector access, and so I can say that for me, if I'm going to have, for example, if I decide on a SharePoint site, it's going to be something that the TMF operations group would completely control. We would be adding the content, right? Because we don't expect it to be very many. We're going to use our CRO's TMF, so I'm not expecting a huge amount of sponsor content. For me, it's, we're also rare disease, genetics, small population. So we do not generate a large volume of content that is considered TMF. So if we control what gets put on SharePoint, and we, for me, I can give that to an inspector. That I'm not seeing any risk, but I have to control it to make sure that there is no risk, right? So I need to make sure that only we're controlling it, that we're trying to follow all the other guidance of, controlling it, making sure that we give access, take away access, all of those good things that we have to put in place. And if I'm confident that that's what I'm following, then I would be okay to give them access.
Okay.
But again, yeah, you need to make your assessment and really weigh everything.
100%. Got to do your research and got to weigh the pros and the cons, like you had said. Thank you so much, Belinda. This was amazing. There were a lot of great questions that were asked. We're going to try and get them answered to you after this session, because we are at time. So, you know, all good things must come to an end. So we're going to try and get those answers, those questions answered. So I'm just going to move on. Next session is at 11, and it is Your CRO Has the TMF, Don't Be Scared, which is coming up on the hour. I just want, again, to say thank you, Belinda, for this very insightful presentation. And I want you guys to also head over to the network lounge. So like head over to the lounge, go to the Montreal booth, chat with booth members, chat with your peers, meet new people, just chill and have a good time. It's about connecting. So, you know, make sure that you're getting familiar with everyone that is on the platform. And again, thank you so much, Belinda, for this presentation, and hope to see you at TMF Week 2023. And I hope you guys have a great rest of the morning. Bye for now.
Thanks, bye.